The next question we're going to try and answer is, are you looking at a child in the paediatric emergency who has Kawasaki disease? So what is Kawasaki disease? It's a vasculitis, which means it's an immune condition, but we don't actually know the true etiology of it. It could be an autoimmune disease, or it could be an abnormal immune response to an infection in a child who's genetically predisposed to it. We don't know the full etiology of how this disease works, but it's important to diagnose because these children are going to need hospitalisation for an urgent echo, they need IVIG, and they need aspirin. So the time I really want you to think about, could this be Kawasaki disease? Anytime you see a child with a fever which lasted 5 days or longer, especially with a rash. So it usually affects children under the age of 5, but can affect those slightly older. Diagnostic criteria, slightly complicated. The key thing is you have to have that fever for 5 days or longer, and then you've got to have 4 out of the 5 following signs. So you've got to have bilateral conjunctival injection, but without exudate. You've got to have cervical lymphadenopathy, which is usually unilateral, but not always. And then you have to have some kind of oropharyngeal changes, which can just be hyperaemia, so it looks a bit redder than normal, or fissures, so cracked lips, or this strawberry tongue, bright red tongue. Then you've got to have some kind of peripheral extremity changes, which kind of occurs in stages. So depending on when you see the child, it might look different. So first it might just be erythematous, then their hands or feet might be edematous, and then finally they get this desquamation where the skin kind of starts to peel off. And then there's a rash, and the rash, there's no pathognomonic rash. It's it could be maculopapular, it could be morbilliform, which means measles-like, or it could be like erythema multiforme. So the rash can really look like almost anything. So you've got to have 4 out of 5 of those. So conjunctivitis, lymphadenopathy, oropharyngeal changes, peripheral extremity changes, and the rash. And then you have to have the fever for 5 days or longer to meet the diagnostic criteria. So try and get those in your head. I'm not going to go through the detailed management of it because I think thinking about Kawasaki's and recognising it is all you need to do. Once you've done that, you can look it up, you can consult paediatrics, you can get the child admitted, and everything else will happen from there. Recognition is the most important thing with this disease. We've got a few pictures here from DermNet. So this is a picture of bilateral conjunctival injection from Kawasaki disease. Then we've got cervical lymphadenopathy, so you can see the right side of this girl's neck is swollen compared to the left, and that fits with the typically unilateral lymphadenopathy that we see. Here's a picture of both fissures in the lips and also the strawberry tongue, that bright red tongue you can see that the little boy is poking out there. Here we have desquamation of the periphery. So this is the third stage in the peripheral extremity changes. Like I said earlier, it could be erythema or oedema just before this. And then here we have the different rashes. So the rash can be really anything. It can be this maculopapular rash on the left. It can be a morbilliform rash, kind of the one in the middle looks a bit like measles. And then it can have these like targetoid lesions, like the baby on the right, who has, it looks like it's got erythema multiforme, but this was actually, again, Kawasaki's disease. So the rash really can look like anything, and it's very difficult to pin down Kawasaki disease on the rash alone. That's not how you diagnose it. So those are the signs. Try and remember, fever for 5 days or more, that's the warning sign, and then 4 out of the 5 other signs that I just went through.